How do I know if my surgical wound is dehiscing? Imagine waking up one day and noticing something unusual with your surgical wound. It might seem small at first, but knowing what to look for can make a big difference. When your body heals after surgery, the skin and tissues are stitched or glued together to close the wound. Sometimes, the wound can start to open up again, which is called dehiscence. This can happen for a variety of reasons, and catching it early is important. So, how can you tell if your wound is dehiscing? The first sign to watch for is if you see the edges of your wound starting to pull apart or separate. You might notice a gap where the skin was closed. Sometimes the stitches or staples that held the wound together may look broken or loose. If you feel sudden pain at the site, especially a pulling or ripping sensation, that could also be a warning sign. Swelling and redness around the wound are common signs of inflammation, but if they seem to be getting worse or spreading, it might be a concern. Another important sign is bleeding or fluid draining from the wound. This drainage can be clear, pink, or sometimes look like pus if there's an infection. A foul smell coming from the wound is another red flag. If you develop a fever or chills, it could mean your wound is infected, which can lead to dehiscence. In severe cases, you might even see tissues or organs through the opening if the wound is very large or deep. Most of these signs appear within the first 3 to 10 days after surgery, but they can happen later too. Certain factors increase the risk of wound opening, such as infection, poor nutrition, smoking, chronic illnesses like diabetes, obesity, or putting too much strain on the wound from heavy lifting or coughing. To protect your surgical site, follow your healthcare provider's instructions carefully. Keep the wound clean and dry, avoid activities that stress the area, and watch for any signs of trouble. If you notice any of these symptoms or suspect your wound is opening, contact your healthcare provider immediately. Early treatment can help your wound heal properly and prevent more serious problems from developing.